Attribution is a concept that determines what provider and organization has responsibility for a patient's care. First and foremost, it's important to understand that there are many types of attribution and it can be done in several different ways. For example, the way private insurance companies determine attribution isn't the same way that CMS does it. Some of these are complex calculations and some are simply a choice made by the patient. It is safe to say, however, that a physician's credentials and specialties are commonly used as part of the determination for many payers. Following this example, the Community Insights ACP algorithm was built as a general example of how attribution is assigned in the greatest number of cases. The first consideration is given to patient choice. If a patient doesn't have a preferred provider on file, attribution is given based on the credentials of the physician. Next, the algorithm considers whether a provider is a primary care provider or a specialist. Visits to a primary care provider are weighted higher than a visit to a specialist, so 2 visits to a specialist would be weighted less than 1 visit to a PCP. Finally, the number of appointments with each provider is considered if a patient has seen more than 1 MD PCP over the course of the year. In cases where 2 PCP MDs have seen the patient the same number of times over the course of the year, the provider with the most recent visit will gain attribution of the patient. Once a patient is attributed to a physician and the organization that physician belongs to, then we know who will be responsible for the care of that patient and also the budget for that care. Join me for the next video as we learn how those budgets are created through patient benchmarking.